Hello everyone and welcome to Pride Action TV. My name is Kim Hunt and I'm the Executive Director of the Pride Action Tank, which is a project of the AIDS Foundation of Chicago. For those of you who don't know, the Pride Action Tank is a project incubator and think tank that's focused on the LGBTQ issues, specifically action that leads to improved outcomes and opportunities for LGBTQ people and other marginalized groups. We bring this show to you once a month with different topics. I want to remind folks that this is a call-in show, so we would love to have your questions and comments. The number is 312-738-1060, and feel free to call in at any time during the show. We have a return guest this month. We have with us one of my colleagues at the AIDS Foundation of Chicago, Alanna Kennedy.
Hi.
Hey, Alanna. So I'm going to read Alanna's bio because she's just an amazing person. I want you to know a snippet more about what she does and what she has done in the past. So Alanna leads the AIDS Foundation of Chicago's federal advocacy and policy work. In fact, she's in D.C. all the time. I'm surprised to see you right now. She also is a fellow for the National Council for Behavioral Health's Addressing Health Disparities Leadership Program, where she is building awareness and knowledge about health disparities and equity, social determinants of health, as well as bringing successful strategies to eliminate disparities in behavioral health populations to her home state of Illinois. Prior to joining AFC, Alanna was Illinois House Speaker Michael J. Madigan's research and budget analyst for Human Services. In that role, she oversaw the Department of Public Health's budget during the budget impasse. Whew, thank goodness that's over. And assisted in drafting the, is this omnibus? Omniums. That's a fancy word.
Yes.
Stopgap budget. Alanna also helped craft and oversee the implementation of the heroin and opioid addiction bill in Illinois, also known as Lilly's Law. Before serving on Speaker Madigan's staff, Alanna attended Michigan State University.
Go Green.
I knew you were going to go there. Where she received a Bachelor of Science in Interdisciplinary Health and Society with a specialization in bioethics and humanities. Wow, that is quite a combination. See, I've worked with you for 2 years and I did not even know all that. So
When I graduated from Michigan State, my own parents couldn't even pronounce my degree, so no worries.
I don't feel so bad then. So thank you for returning to the show.
Thank you for having me. I'm happy to be a friend of the show.
Yay! So we should note that today, December 1st, is World AIDS Day. And a lot has changed over the years in terms of AIDS and HIV prevention and all kinds of things, and the Tribune just released some interesting news today, and I'll let you delve into that because there's some significant, there was a significant finding this year.
Yes, so thank you again for having me on the show, especially today of all days, World AIDS Day. I know when we had scheduled this to talk about open enrollment and healthcare, we didn't realize that it was actually going to be World AIDS Day, but I think this is an important day to be having this conversation, as is every day in my world, talking about healthcare. Today, the Chicago Tribune was talking about on December 1st the fact that Chicago rates of new infections of HIV are the lowest it has been in a decade, which is amazing. And a large part of that, though, is because of the Affordable Care Act, or as we'll call it, the ACA moving forward. It also has been called Obamacare as well. This law was passed in March of 2010. Even though a lot of people are concerned about whether it actually is the law of the land, I'm here to tell you today it still is.
Right now it is.
As of right now it is. And we will continue to delve into that and what that means later on in the show, obviously. But another large important thing is the fact that the FDA approved PrEP in 2012, pre-exposure prophylactics. And that has been very impactful and very important to the fact that we've been able to decrease the amount and cases of HIV. But you couldn't access PrEP without the Affordable Care Act.
Right.
So that is once again, another reason why it is so important that we continue to have the ACA. And why this period, especially right now, which we'll delve into later, is also so pivotal.
So that is very, very exciting news, and I hope people appreciate how meaningful that is to have rates be so much lower than they have been in the past. And as you said, that wouldn't happen without health care coverage for more folks and access to PrEP. So we need to continue the fight to keep both those things going.
And it's a good point to also note that there are still structural barriers, and there's still more that needs to be done to continue our fight. But these are two important steps, and I hope to continue to be a part of that.
We gotta improve access and
no
awareness.
doubt.
Yeah. So we are in this interesting time right now called open enrollment.
Yes.
And people hear the term, they may or may not know what that means and what it implies. So you and I have talked about this over the last week or so. We really want to delve into this and also just remind people, feel free to call in 312-738-1060, because this is an opportunity to have some questions answered if you're confused. So what is open enrollment?
Yes. So I am a self-proclaimed policy wonk, and especially with all things healthcare. So I'm eating, breathing, living this all the time. So I will do my best to break it down and explain it for everyone who's listening today. So in 2010, when President Obama signed the Patient Protection and Affordable Care Act, like I said, the ACA, it started the marketplace as well as Medicaid expansion. So open enrollment is the period in which people can sign up for insurance if you do not get it through your employer or are not eligible for Medicaid or Medicare. Now, during the open enrollment period, you can sign up, shop around, look at different health plans on the marketplace. Here in Illinois, we use the federal marketplace, which is healthcare.gov.
And let's take a look at that website. That's the healthcare.gov website.
And on this page, you can actually shop around, look and compare at different plans, different insurers and providers, and see what you've got out there. Now, I will hold back and say not providers exactly, but insurance providers.
Insurance providers, yes.
So during this open enrollment period, you have the opportunity to look at plans. Now, it started November 1st, and it is going until December 15th. So you have 15 more days from today being December 1st.
2 weeks.
Yes. It is important that you shop around. It's important that you don't procrastinate and that you do this as soon as possible.
And when would healthcare would start for folks who enroll by December 15th?
So if you sign up by December 15th, you'll have insurance starting January 1st, which is important. If you are someone who has a chronic disease and requires certain medications every single month, you don't want to have that gap in care.
Yeah.
You also don't want to pay the penalty. Now, the ACA is still the law of the land, and as a result, it is required that you have health insurance. That term is called individual mandate. So, the individual mandate requires you to have health insurance. So, if you don't want to pay the fine, it's important that you sign up by December 15th. But it's also important for your health.
Yes. And healthcare.gov, again, is the website.
Yes, healthcare.gov, and sign up by December 15th.
Now this open enrollment applies to folks who are getting insurance through the marketplace.
Yes, so an important part of the individual mandate, as well as having the marketplace website, is a lot of people actually sign up or go onto the website and find, I'm actually eligible for Medicaid. Now the Medicaid open enrollment period is different. You can sign up for that at any point throughout the year. You can sign up today for Medicaid and even after the December 15th period. However, if you do not qualify for Medicaid, it is important that you sign up by December 15th.
Very good. So keep that date in mind. And we keep throwing out December 15th because that's the date this
Yes.
year. But that has not been the case in the past. Let's talk a little bit about this open enrollment period compared to previous open enrollment periods.
That's a great point, Kim. So, in years past, the open enrollment period has been significantly longer, up to 3 months in some cases. This year, the Trump administration has slashed that in half. It is now 45 days. 45 days, which is very significant and very impactful on the health of the marketplace and making sure that enough people sign up for it. We've seen historically the majority of people sign up for the marketplace on that second half, especially healthy individuals who might be procrastinating to the last moment. A lot of people who have chronic illnesses, know that they need insurance, or have had it in the past, are those ones who start early, start up and sign up. If you want healthy individuals to sign up, having that longer period has allowed more people to slowly sign up. Now, we have a shortened period, like I said, 45 days, December 15th. So, we're going to need to have that happen at an accelerated rate in a short amount of time. So it is different. This, once again, is another way that the Trump administration is attacking the ACA and trying to show that it's failing by trying to show that less people are signing up. However, we're finding out that a lot of people are signing up right now, which is really important. Now, I will say that inevitably people were talking about maybe shortening this period, bringing it down. Insurance companies were really excited about this. However,
There's always a however.
yes, the intensity to which it has happened, that 45 days, was never the intention. The abruptness to happening it was not the intention of it. It was supposed to happen over time. They were going to shorten the period. They were also going to roll out more outreach and enrollment and fund appropriately navigators and doing all of that. However, once again, another way the Trump administration has tried to undermine the ACA and have less people sign up is slashing funding. Outreach has been cut significantly, and the radio talk shows and the outreach on television has not been happening like it has in years past, which is also a way that they're trying to undermine the success of the ACA.
But despite that, we know that outreach is happening because what are the numbers now?
So, we are seeing at a record rate people are signing up. After 4 weeks, last year, only 2.1 million people had signed up nationally. We're seeing 2.8 million people signed up, which is surreal and amazing. And it shows that a lot of the work that people have done throughout the year, pushing out and showing the significance and the importance of the ACA, has paid off as well.
And people clearly want
Very clearly. In Illinois, at this point, after 4 weeks, we had seen 68,000 people sign up for the ACA, which is a respectable number and very great. However, this year we have at a minimum, 95,000 people have already signed up in 4 weeks.
Wow.
It's amazing to see.
Wow. So you mentioned earlier, though, that folks who are healthy tend to wait later to sign up, and they may even be questioning why they need to sign up. Talk to folks about that. Why is it important for healthy folks to sign up for healthcare insurance?
So obviously we know if you have a chronic disease, if you're someone who is living with HIV, you have medications that you need to take every single month, and it is important for you to have health care. So a healthy person, a young person, someone like maybe myself, would say, I don't need to have health insurance. However, you never know when that game of touch football or lacrosse is going to send you to the hospital, and when you are going to need that care. Because a lot of young people aren't building up or saving up for a catastrophic event to happen, and you don't want to have those insurance bills, medical bills, at your door or in your mailbox. So it's important that you sign up for care. another thing on a technical side of things is that insurance is also important for the marketplace. To have a thriving marketplace and a healthy marketplace or insurance risk pool, you need to have a balance between healthy individuals and sick individuals. That balances things out and makes sure that costs stay steady and don't increase because there's a lot more chronically ill or sick patients who would be tapping into the marketplace.
Now this, I think a lot of folks don't have a real appreciation of all the different ways that the ACA has really improved healthcare options for folks. So, and with that, because it's such a complicated bill, all the different ways things can be tweaked in such a way that it can hurt people. So we were talking about cost sharing earlier. Let's talk a little bit about that and why folks need to be aware of that in their policies.
Yeah, so another way that the administration has tried to undermine things is through saying and threatening continuously and then following through with the fact that the Trump administration has said that they will no longer fund cost sharing reductions. So immediately a lot of people went into panic. Those cost sharing reductions are very vital for families, low to middle income individuals, because it makes healthcare affordable. I'm so excited and delighted to say that even though the Trump administration has said they will not fund the cost-sharing reductions, they are still in existence and they are happening. The law of the land says that the cost-sharing reductions need to happen, and the insurance companies are on the hook for it. So they are still going to happen, and actually we're finding that as you increase the cost of insurance, so do the cost proportion of cost sharing reductions increase. So a lot of people can find health insurance for as low as $50 a month. Between 50 and 100 is what we're hearing in a lot of cases.
So the cost share is actually a subsidy for folks?
Yes.
Okay.
So it allows insurance to be more affordable. So why it's also important for you to shop around and see is to see what's affordable for you, what works for your plan. And part of that cost sharing reduction is an important part to seeing what's affordable for you and your family.
Okay. Now, you and I also know that the LGBTQ community has has particularly benefited from the ACA.
Yes, actually the LGBTQ community has benefited in largest proportions to any other demographic group, interestingly enough, especially that low to middle income portion of the LGBTQ community, specifically individuals of the transgender community. So prior to the ACA, 60% of people who were transgender did not have access to affordable healthcare, but healthcare in general. Unfortunately, prior to the ACA, being transgender was considered a pre-existing condition, which is horrible. And because of the ACA and Section 1557, people cannot be discriminated based off of race, gender, a slew of things, nationality, place of origin. And this is really important because you having access to healthcare and having gender-affirming care and having that is really important for the health of you, your family, and community as well.
So again, open enrollment deadline December 15th. I want to be clear, December 15th.
Yes.
Go to the healthcare.gov website if you're in Illinois and find coverage that works for you. We want to be very clear on that. ACA is still the law of the land.
It is. And I also want to say that you don't have to do it alone. Healthcare is a daunting thing. I know personally sometimes I can be a little intimidated when I'm shopping around, and I know a lot of my friends and family can be feeling that way as well. It's not something you have to do alone. there are navigators that can help you through this process, as well as insurance brokers. Now at AFC, we also provide services, so you can call and visit our website at AIDS Foundation of Chicago, and you can have people who can help sign you up and help navigate you through that process. Now, it's also important to keep in mind that cost is a large thing. You know, when you're thinking about signing up, having that high cost every single month that you have to pay can be daunting. However, it's also important to know that cost alone and just having insurance isn't enough. It's also important to make sure that your plan covers the drugs that you need every single month and is affordable. I think that's where a lot of people get also concerned and say, this insurance is too unaffordable and it's not accessible to me because my doctor's not on it, or the doctors that I want are not on this plan or covered by this plan, or my drugs are not being covered. So what you can do is shop around, make sure your doctor is covered with the navigator, and make sure that the drugs that you have are being covered as well.
So we have a caller, so let's, and I know we just have a few minutes, so what's your question or comment?
It's a comment. I think your guest failed to point out that in transgender situations, I worked in healthcare for years for a very large provider. Healthcare was meant to help people with illnesses and injuries. Being transgender, whether you think you're a man, woman, old, young, that's not an illness or an injury. It's a frame of mind. So you were talking about the costs involved. You can't rush through these things with pointing out all the information. You also weren't allowed to keep your doctors. So there were a lot of things wrong with the ACA. And it's good that there's an open discussion now. But again, it's just like the abortion issue. When someone gets pregnant, that's not an illness or an injury. It's a direct result of two people having sex.
Thank you for your comment. We really appreciate it. These policies are complicated issues.
They definitely are.
That there's a lot that has gone into the discussion to get to the ACA and why it's important, and all of the different issues that are important to individuals.
You know, this morning when I was preparing and looking into things today, I was reminded that I was actually on here 4 months ago. And we were talking at that time about the repeal of the ACA and the fight that was happening. And I remember mentioning during that time that the ACA is the bare minimum image. It's a platform and a starting point to improve healthcare access. There are a lot of things and a lot of barriers that still exist and that need to be improved upon, but this is one step, and signing up and making sure that you have insurance is another step to ensure that you have a healthy life and healthy lives for your community and yourself.
And that includes your reproductive health and
as well.
Gender affirming health as well.
Definitely.
We have another caller. Hello?
Hello. Hello, my name is Tyrone. I'm a gay male and I'm employed, but I could become unemployed at any time. There's no noise, employment at will. I mean, should I worry about doubling my insurance? Not so much doubling it, because I would only use the insurance that I have at the time. So should I sign up with the current plan out there that you're discussing just to ensure I have some coverage if I should become unemployed?
Thank you so much for the question.
That's a great question.
I want to make sure that this is something that you also are talking about with your employer and continue this dialogue. I am only an opinion, and I would hope that you would continue having conversations with your provider and your insurance company. But what I will say is that if your employer does provide insurance and that insurance is something that you would like to pursue, I encourage you to pursue your employer insurance. If, however, you become unemployed at any moment, there is a period at any point during the year that you are to become unemployed, you are to get married, or have another dependent come onto your plan. That is a special enrollment period that you are allowed to sign up on. So you do not need to sign up for double health insurance. And do not worry that if at any point you do become unemployed, you still will have access to health care.
All right. So thank you for the calls today. I know that in addition to the fact that we have health care now, the ACA, there are threats still.
Yes.
to repealing or removing the major provisions in the ACIA that help it make sense
Yes.
and a viable piece of legislation. So this tax bill, for example, in the few minutes we have left, let's talk a little bit about that and make sure that people know how they can get involved.
So, I'm going to say tax plan. It's more Christmas tree. Things are being tacked onto it right and left as you move forward with things, as it continues to go through this process. And one of those things that have gotten tacked onto it is this idea that they will remove the individual mandate. Now, removing the individual mandate will have a impact impact on the access of healthcare and the healthcare world, as well as the ACA. They estimate that about 13 million people will lose their health insurance if the individual mandate is repealed. The individual mandate also draws people to healthcare.gov. In some cases, they find out that they are eligible for Medicaid, which is really important as well, which you can sign up for at any time. But it also encourages people to get healthcare access in case there is a catastrophic event or in case a life event happens that they weren't planning for, that they need healthcare. That individual mandate is an important part and lifeblood to the ACA. It also makes sure that the market for insurance companies is stabilized. And I can tell you there's one thing that insurance companies do not like, and that's a destabilized marketplace. So there's lots of threats happening still to the ACA, but the biggest way that we can ensure and show that there's a thriving market is to sign up. And I think we're already seeing that. People want healthcare. People want a thriving healthcare market because so many people have signed up. Once again, like I had mentioned, more people have signed up after 4 weeks than ever before in the history of the ACA. But we have a shortened enrollment period, and that only goes until December 15th. So it's important that you go to healthcare.gov to sign up by December 15th.
Again, healthcare.gov.
Can't stress it enough.
Can't stress it enough. December 15th is the date. Alanna, thank you so much for coming back on and to talk about this important issue. You have only 2 weeks to sign up for healthcare insurance through the ACA, through the marketplace. It's World AIDS Day again, and let's everyone take a moment to pause on how significant it is that we have so fewer transmissions, however, so much work to do that's left. One of the major initiatives going on at the AIDS Foundation and in the state world as a whole is getting to zero.
Yes.
And so we really want to get down to functional zero, I think is the term.
Yes.
So we'll have someone on next month to talk about that issue. But in the meantime, this was our December show, so we won't see you until the new year. So happy holidays to everyone, and we hope you have a great new year. And we will see you the first Friday in January.
Thank you
Good
for
night.
having me again.